this is Smita Kumar, and you're watching Rendezvous with Smita. Today, at our one of the sessions, we are having Vikas Katoch. He is Chief Operating Officer, Right Health. He has 15 plus years of experience in the healthcare industry. He has a strong leadership skills in handling and building up teams and finance processes and new setups. Hi, Vikas. Welcome to Medicircle.
Hello, Smita. How are you?
I'm good. So, Vikas is a Dubai-based entrepreneur, and so from here, all of us, a very warm welcome, Vikas, and we would be having some quick questions with you. So, to begin with, we see a lot of automation happening in the healthcare industry. As a healthcare finance enthusiast, what do you think of the affordable healthcare tag that most healthcare startups are using as their USP today?
Okay. First of all, thank you, Smita, for hosting me here with you in terms of a healthcare delivery. Now, coming to the question regarding automation in terms of delivering the care, and specifically the affordable care, which Right Health is pretty much into it from the beginning. And we are the largest and fastest primary healthcare organization in the UAE with 57 facilities across most of the Emirates. And now, in terms of automation, how I see is that initially automation was linked to just the IT process. In a normal layman language, IT is equal to automation. But how we see here is that how automation is converting the delivery or how automation is helping in the care. So when I see the automation, let's say in the Right Health and in the industry here in the UAE, is pretty much basically how can we automate the task and how we can automate the care. When I say automate care, which means use of technology to increase the speed of the care in terms of maybe a registration of the patients, in terms of even a primary care given to the patient by the doctor so that reports are given on time. It's pretty much real-time basis. And in terms of a record management of a patient, or even is coupled with some of the other initiatives wherein you are handling your patient irrespective of the position or the location he or she is in. Now it is coupled with a concept of telemedicine, which is not a new concept, is becoming the new normal in the UAE. Or it becomes, let's say, automation in terms of robotic processes, which is not pretty much used so far, but I see it is coming in the healthcare industry. I've seen robots moving around in the pharmacies pretty much in healthcare sector in the UAE. I have seen some of the robotic processes in the healthcare in the OTs also. Not everyone is using it, but yes, I think specifically in the affordable care, you need to give something extra. You need to provide some extra care to the people with some sort of automation. Now it can work with the digital dispensary, which we as a Right Health is working on. It can work as a digital dispensary. So rather than deploying a manpower and deploying a full nurses, doctor staff, we are going to set up soon our digital clinic, wherein it is a clinic equipped with the infrastructure, not just the telemedicine. And we are providing a care to the patient, and either they are coming to us or even if they are sitting in the remote areas, because it's very hard to reach to every patient. So that's how I see it. But I would say it's more of accessibility.
Yes.
With
Right.
the care.
So Right Health is committed to transform value-based healthcare and touch more than 1.8 million lives by 2022. That's a huge number. So what, according to you, is the future of healthcare?
Got it. So fortunately, this was our aim when we started in 2017. So we have already touched 1.6 million lives. Every year we are touching. So in terms of the aim which we have seek for, or which we were seeking for back in 2017, so that in any case we are surpassing by any means. Now coming to that, what is that transforming that value-based healthcare is that we want to provide a care at a doorstep of a working population, because even as per survey, 77% of the population in the UAE belongs to the people who earn less than 7,000 dirham or so, which you call it a low or mid-end population. So when you have that population, you can't survive without serving those populations, right? So it's our duty to transform that value-based healthcare, like I said, by either automation or by reaching to that clientele or the patient, or working with hand in hand with the insurer, which is, you call it a B2B relationship, which is the now new need of the hour, and then this is the now delivery of the business, wherein you are not going to every patient, but you are tapping the insurance company, let's say, and you have go hand in hand that, okay, what is the requirement? Do you want to open a clinic in the extreme areas of, let's say, Dubai or Abu Dhabi or any other emirate? Do you want to provide extra care in certain areas? So anything which is predictable, we are doing. Anything wherein there is a high demand by government, by authorities, or by insurance companies, we are there. Or wherein we are working as a partner hand in hand to transform that value proposition also, so that we become a value healthcare provider to the insurance company directly and to the corporate. So it's like a win-win situation for a corporate, insurance, and the patient, wherein we are delivering the care at a lesser cost, which is helpful for the insurance, and at a doorstep of the population, which means is like a necessity requirement, or a daily requirement of that working class population who can't just commute everywhere. It's easy for you and me to transform anything or a transport here and there, but for the people who are earning, let's say, 2,000 3,000 dirham, is not very much possible. You need to go there at their own doorstep. That's what we are doing, either handling the COVID situation, or going door to door, or going to their population, going to corporate, going to providers, even the payers and the regulation. So it's all basically a all in all effort of everyone as a whole ecosystem of healthcare. So that's what we are working on, and then that's what we are delivering.
So because Right Health aims to deliver quality healthcare, as you said, with four core objectives. One is prevention, second, efficiency, third is effectiveness, and fourth, innovation. So please tell us how challenging it was when COVID was on its peak.
Definitely, it was challenging for us, as it is, and as it was for many other healthcare provider, even across all the world, even if it's patient or a corporate or the payer. Now, the most challenging part, rather than giving the service, was to take care of your own staff first. Because those are the frontline workers who are working for people. So that was the biggest challenge for us. Unfortunately, we had 70 people who got infected. And as a Right Health, is our liability, or you call it our responsibility also, towards public and even our own employees. But fortunately, everyone is safe, everyone has worked, and has come back to office, because those are the people who are serving the care. So that was the biggest call it block for us. But eventually we passed by, and then staff was very much cooperative. We were always there for any help. Fortunately or unfortunately, we didn't close our clinics, because that was the mandate given to us even by the regulations. So that was there. But yes, in terms of prevention is the need, because if you go to any Western countries, primary healthcare is the only healthcare solution which is working everywhere. And for the reason for that is that you don't go for a disease first, you manage that first by prevention. Now, prevention can be there in terms of your health checkup. Prevention can be there in terms of your normal checkups, plus the prevailing disease management. So that's what we are working on, either automatically or remotely. That was there. But yes, managing the operations during COVID with less manpower, with more restriction, was a big headache. But now I can see government has helped everyone. We are fortunate enough to sit in this country wherein everything was properly planned, deployed, and managed. So I believe so we have surpassed that era wherein it was a big you call it pain in the system. Now also it is there, but it has improved a lot. We are in a better place, a better space now. And it's every day for us. Every day is innovation, and not in terms of developing any new thing, but anything which we can help the patient to provide care at a better cost, at a better efficiency. That's what we are doing. And now I believe it is managed well. It is now effective solutions and efficiencies in place, which is happening every day.
Yes. You have been the head of finance, director of finance, and now CEO. So what drives your motivation?
So what drives me, more than anything, being a finance guy or a non-finance guy, I want to make this company, you call it a best preferred provider in this region for primary healthcare. That's what I started working on when we started this company, when there was no right health clinic or pharmacies or lab. Now in the last 2.5 years, we have made it to 58 clinics. Our game and my motivation is always, to do something for the society, which is as a overall. Obviously, from the company side, we want to make Right Health as the best healthcare organization and most valuable brand. And when I say most valuable brand, which means, people should be proud to be associated with the Right Health. That okay, this is the organization we look for. Patient should see this is the clinic I should look for, and even every employee of the organization should look for. So that's basically, you know the premier goal for me in the organization, to transform the healthcare for the market, and obviously to transform this company to a company which is like, when we see us even after 1 year, you see, when, yeah, I saw Right Health 1 year before, now it's amazing company. This is what I'm looking for. It's all about transformation, either the healthcare industry or even our own organization at a broader level.
Yes, that means it's really, really great. I mean, thank you so much, Vikas, for coming to Medicircle and sharing your insightful views. I think transformation is the key. We we keep on changing, we keep on upgrading towards the next thing, and may whatever come in the way, we should definitely succeed. I think if we have got the confidence, we should be definitely reaching our goals. So thank
Definitely,
you so much,
definitely.
and all the best to you and your team for all your future endeavors.
Thank you very much. Thank you, Smita. Thank you very much. Lovely speaking to you.